Well, still morning at NTV, we journey on looking into the evidence-based practices for sickle cells management. I am Priscilla Regina Neloga. The backbone of it being that next month Uganda will be joining the rest of the world to cause awareness and advocacy for sickle cell disease that has taken so many lives across the world. Currently in Uganda, you do have 19,000 people living with the disease, and only 6,000 of these are actually on active medication. Now, experts are calling for more sensitization among the population and the importance of knowing your sickle cell status. We are joined by Daniel Roy Odur. He is the Executive Director for the Uganda Sickle Cells Rescue Foundation, and he's going to be speaking to us about this disease in detail. Good morning to you, Daniel.
Good morning, Sheila.
Nice to meet you. Now, we want to first find out what's the status and the prevalence of sickle cells for us in Uganda.
Thank you very much, Sheila, and I'm grateful to NTV. Currently in Uganda, we have about 13.3% of people having the sickle cell trait in the entire country, and annually and that contributes to about 0.7% of people living with sickle cell disease in the country. Currently, we have about 25 to 30,000 people who are being born, or children who are being born with sickle cell in the country. And out of that, we normally lose off about 80%, which is about 20%. Which do die off before their 5th birthday. Yeah. And this is quite alarming. Then if that is about 80%, then we are left with about 20%, which is about 5,000. And out of the 5,000, we still have quite a number of some of these patients of ours who struggle to access better quality services in terms of care and treatment of sickle cell across the country.
Okay, and then it begs the question that what strides have been made in promoting the care of people that are having sickle cell anemia?
Yes, as Uganda Sickle Cell Rescue Foundation and other partners like Roofings, BMK Group, AGT, and other partners, we have harnessed up our efforts in ensuring that we have a one-stop center for counseling and referral, which is situated at BMK House. Mm-hmm. We do link these patients to different doctors across the country, Mulago, Zambia, and some centers of excellence across the country. In terms of care, we have trained quite a number of caregivers with basic home care management of sickle cell. And this is yielding fruits because quite a number of some of our warriors, their episodes of pain and attacks have drastically reduced, because you cannot keep on dashing to the hospital all the time. But if we take you through the basic care and management of sickle cell, you will be in position to ensure that this particular patient is wearing something warm when it is cold, the patient is hydrated, good nutrition, and so on and so forth.
Okay.
Yes.
All right. Now, I know that the medication is expensive,
yes,
and on top of being expensive, it's barely accessible, especially to upcountry people. And so what are the measures that, as a rescue foundation, you are creating and putting under which to make sure that there's accessibility of some of these medicines and treatments? Fantastic.
As a foundation, we have galvanized our efforts with a number of partners. Recently, we saw JCRC giving out donations of hydroxyurea. Mm-hmm. We have also advocated for the reduction of the prices of hydroxyurea, because if you went to any other pharmacy right now, the prices ranges between 700 shillings per capsule up to about 1,500. And for somebody deep down in Bundiwujo might not easily afford this. And some of this still comes in as donations. And we have been urging on the government, one, to help us, and where possible. And just like how the manufacturing of ARVs came into the country and also more donations, it would also be prudent enough that we have pharmaceutical companies that probably will be invited into the country to help us to manufacture some of these drugs. We have been having donations from Novartis. They have so far donated quite a number of hydroxyurea into the country. And the Ministry of Health is also trying its best as well to ensure that we do have some of these donations. But across the country, we have been having some stockouts, and this is still a challenge because we have not yet fully gotten access to a huge procurement of some of these medications.
Okay.
Yeah.
Let's talk about the testing services equally. How accessible are they across the country, and is it the kind of testings that are up to standard, and the people who are supposed to be using those testing services, what's the coverage for them within their areas and their regions?
Okay. In terms of testing, it's still a challenge countrywide, because each testing kit for any layman or like for any peasant down there, most especially in these belts which have the highest prevalence. Northern Uganda, Lango and Acholi has the highest prevalence. And once you trickle it down, you go to Lango. And Lango, then you go to Aleptong district. And somebody deep down in Olilim might not be in position to probably afford 50,000 shillings to go and have a test. But at Uganda Sickle Cell Rescue Foundation, with support from Roofings, Hotel Africana, BMK Group and other partners, we have been in position to offer these services free of charge. Totally free of charge. And we have been moving across the country to offer, one, free counseling services, free home-based care training for the caregivers, free screening, awareness and advocacy. The coverage of testing is still scanty in terms of different rollouts, because one, less priority has been given to sickle cell. In most cases, we only get to hear people sounding drums and running around at the World Sickle Cell Day.
Okay.
Yes.
Yeah.
But these other normal days, once that is done, that's the end of it.
Okay.
But we are here saying that we are offering this, and every first and last Wednesday of the month at BMK House, we do that free of charge. And we also have outreaches, totally free of charge.
All right.
Yeah.
Now, I know the statistics that are officially recorded give us 19,000 people that are actually walking on a daily with this disease.
Yes.
However, only 6,000 of those are on active medication. What advocacy and how are you going to be able to bridge the gap to ensure that the balance or the gap in between there can also get on active medication to prolong life?
Fantastic. Through our different channels of communication, we have been working very closely with kingdoms. You would recall about 2 or 3 years ago, in collaboration with the Uganda Kingdom, we had 3 Kabaka birthday runs, and this was being aimed at causing awareness and sensitization, and also to scale up on screening. We have also involved a number of church leaders. We have gone to different churches, the mosque, and so on. But we still find a challenge that there is a lot of misconception on sickle cell. If you went to some village, like let me say in Bukedia, somebody would tell you that sickle cell is due to witchcraft. And telling such a person to come for screening or testing would involve the church, traditional leaders, opinion leaders, and even the politicians. Because believe me, if you organized for a massive testing around anywhere in Kampala, don't be surprised that the numbers of those who will come for screening will not, it will not yield much. Much as you have communicated time and again. But I would propose that if we had the same approach, like how His Excellency the President advocated for the prevention of HIV, if we had the same approach, believe me, we wouldn't be having these numbers of 25,000 children being born with sickle cell disease in the country. We would be having lots of people dashing to access care and treatment in our country in terms of sickle cell.
Okay, all right. Now it begs the question for those that do have the disease, what are some of the challenges that they encounter throughout their lifespan? Then also on the side of your organizations like yours, what are the challenges that you're facing against maybe an enabling environment by government and the society as a whole perception?
Yeah, in terms of our patients or our warriors, we call them warriors because of the different episodes of pain that they go through. One is the limited access to medication. We have talked about hydroxyurea. In most cases, you will find that you will go to some facility, we probably have 250 milligrams or grams, but then somebody has been prescribed 500 grams and so on. Then in terms of essential medication, you will find that in some of the facilities, they might not be having folic acid, and health education is not being given out to the caregivers. If you brought a patient to the medical facility, they treat you as it is, where it is. But they don't take you through some basics that if this has happened, please, we expect you to observe this, and this is the nutritional side of it, which you have to take on. But also, most of our warriors and their caregivers have possibly not been in position to even raise any income, because we now look at sickle cell as it impedes growth, economic growth of any family. Each and every week or month, you're running to the hospital, You can't save money. You can't totally save money. And then also, in terms of bone marrow transplant, we have quite a number of families that would want to do that. But we are not yet in position to basically do that in the country. So people have to raise money, running out and doing stuff like that. And somebody deep down in Kamwenge, where might not be in position to raise these monies. And that becomes quite a very big challenge in terms of treatment and care. In terms of the CSO space, we are very grateful to the Ministry of Health. They oversee our operations, and but there is still a challenge in raising funds across the country. Because remember, sickle cell is a non-communicable disease. And if you went to the Ministry of Health and you're looking at the chart, like for example, which is the #1 killer disease in the country, somebody will pull out a paper, malaria. And any donor that comes in the country, even USAID.
Donation to malaria.
Yes.
Okay.
So that now underrates sickle cell.
So in that capacity, what is your call to action for government? Where should they come in to ensure that they protect the other Ugandans?
Our call to government, one, is that I think we need to legalize the aspect of it should be on condition that before you have children, you need to check for your sickle cell status. People have only been running for HIV tests, hepatitis, but we have neglected sickle cell.
Yeah, but I see charters, for example, having taken a stride in that direction, and now they do have sickle cells added to the tests that couples must take in churches. Churches,
yes, and this is coming as a result of our knocking onto the different doors of the different religious denominations that please, before you join some couple, please have them get tested for sickle cell. We have counseled people 1 week into their introduction. They are both carriers. So how do you advise them? You know?
Okay,
yeah.
Okay, which services you do offer with the foundation. Now let's talk about next month, as Uganda is going to be joining the rest of the world to create awareness and advocacy for sickle cells as a disease and better livelihood around that disease. For us here in Uganda, what should be our focal point?
I would want to look at this from the view of the organization, then I bounce it out. In terms of next month, which happens to be the Sickle Cell Awareness Month, September, we have lined up quite a number of activities. One, we shall be having a back-to-back or end-to-end Twitter spaces aimed at raising awareness and advocacy for sickle cell disease. But on top of that, we have normally organized sickle cell conferences, and this year we shall have one in Lira City, and it's revolving on evidence-based practices. We are targeting nurses, because we believe that nurses are the first point of entry or care at any medical facility that these warriors do go to. And why Lira? The region has the highest prevalence of sickle cell, and we need to demystify on certain myths that probably even the medical personnel probably have. And if we train these nurses on basic home care management of sickle cell, this and that, we believe that once these patients come to access their facility with their caregivers, it will have a trickle-down effect even to those ones who will have not attended this. On top of that, we have lined up different shows and this and that, just aimed at causing awareness and sensitization for sickle cell.
Okay, all right. In your closing, Max Daniel, what's your call to action? One, to families that have members, loved ones that do live with sickle cells.
If you have a warrior at home, this is the time, this is the month that you should get closer to them like never before. Hold them, hug them, care for them. Sickle cell is not sexually transmitted. Sickle cell is not airborne. It's just a genetical disorder. Stand with them, love them. If you hold them, if you hug them, you won't die. Take them to the hospital at the right time. Don't wait for the crisis and the pain to intensify, then that's when you run to the hospital. Hydrate. Keep them warm. Don't let them overwork, because sometimes they might be having some pain and stuff like that, and you are like, Odur, you don't want to go and work, you don't want to go and do this, and you end up overworking them. For your information, a normal red blood cell in your body should last for about 150 days. But for a warrior, it takes about 15 to 20 days.
Wow. And
you want this person to overwork.
Okay. Well, thank you so much, Daniel Roy Odur. He's the Executive Director with the Uganda Sickle Cells Rescue Foundation, and he has shared that 2 days in a week, that's especially on Saturday, and
the first the first and last Wednesday of the month is when we do free sickle cell screening at BMK House, Hotel Africana, first floor.
Okay. Yeah. All right. So if you have a loved one, or if you know of someone that is in your circles that has a warrior of sickle cells, then please be able to make use of those services that are freely provided for, because again, he has talked about the impact of it on your pockets and your economic development. It's challenged because constantly you have to cater to their needs, especially as far as medication is concerned. But we trust that God is in control either way. Well, that marks the end of this conversation. Looking forward to the September Sickle Cells Awareness Month, and we'll be doing more advocacy then. We'll be taking a short breather. We'll be returning shortly.